The following is a live recording of the Brandon Systems ClearVue COVID-19 case management tool. At the conclusion of the webinar, we invite you to stick around for just a few minutes. We have some key features we wouldn't want you to miss. Thank you. Good afternoon, and we're going to get started. My name is Janet Blagg, and I am the Director of Solution Delivery here at Brandon Systems. And I want to thank you for taking your time to join us today. Firstly, we're recording this session, so it'll be available to any of you as requested. Additionally, you're welcome to use the Q&A section at the bottom of your monitor. We're going to be having Bob Rice. We'll be monitoring our Q&A, and where we can, we will answer your questions live, and where we cannot, we will be sending out the Q&A to each of you at the end of this session. I know you all are very busy during this crisis, so I assure you we'll be as brief as possible in our presentation, and I hope that you'll see that this is helpful and can be helpful for you and your community. With the volume of infections, we understand that the growth of the cases will be exponential as our testing increases. So the intent is for this application to help those with limited resources to manage their caseload. And more specifically, the intent is for this to be distributed to government and health agencies for free for the first 90 days. So briefly about Brandon Systems, we are a product consulting company. We focus primarily in the healthcare space, and we've been in business for over 40 years. So these are some of our partners that we have worked with over those years. Specifically, these are some of the technologies and healthcare services we provide, and some of the clients that we've supported along the way, and some we are currently supporting today. Now to the meat of why we're here. So when COVID-19 started, our CEO asked us, what could we do to help? And we asked our clients and our partners and our team members to come up with ideas and opportunities. We did land on several solutions, including using our healthcare case management solution to assist with local health organizations who are now tasked with tracking, reporting, and following up on the cases in their areas. Now, we've heard that many of you are doing this manually. You're using Excel spreadsheets, you're even using paper documentation. So all of this can be time consuming and it can lead to errors, and I know we've heard from many of you it's stacking up. So we hope that what you see today might be useful. So this case management system sits on what we call our ClearVue Brandon system product. We are in the third generation of our healthcare workflow solution. So as you can see on the right here briefly, these are the components that comprise and make ClearVue workflow solution. So you have the standard intake of an issue, an assignment, a case, the rules engine, it goes through its routing, monitoring, customization, capabilities for forms, letters, and various reports you have, the way you want to see your dashboard, obviously security, and then audit. So being able to do this on the ClearVue platform makes us a truly dynamic workflow tool. So in the case of this case management, we worked with some of our local contacts at our health organizations near us, and we started on creating this flow, and this is just an initial process. After the presentation, if you think this will be helpful for your organization or you have some input that you'd like to provide us on this process, we'd be more than happy to work with you. But as you know, we have the intake, which many of you guys are doing manually. With case management, we're going to turn this into an automation capability where you can then go through the workflow process and prioritize. You'll be able to do different various types of follow-ups by telephone. You can do follow-up by text messaging, having individuals log on via their browser at home or through their mobile device. You'll have the capability with your dashboard to set alerts and deadlines for your follow-ups and other activities. You're going to see a dashboard where you can track your various cases based off of the various prioritizations you have or the various ways you'd like to sort your cases. Also will enable you the ability to export your reports to other local healthcare agencies, CDC, health department, and forward. So we will be offering this license free for 90 days, and we are discounting our configuration and support pricing. So with that, I'd like to introduce Nick Migliaccio. He is our product specialist, and Bill Slovan, our VP of products. They will be running us through the demo today. And again, we have Bob Rice on. You might hear him come in with a live question from one of you all, so feel free to start your questions during this demo process. At this time, I'd like to hand it over to Nick.
Thanks, Janet. Good afternoon. I'm Nick Migliaccio. I'm one of the product specialists for ClearVue's COVID-19 case management solution, and I'm going to be going through the live demo portion of the webinar for you today. Just starting with an overview, the two areas of focus we've targeted when developing this system are the ability for frontline staff to track and follow up on the status of a COVID-19 case, as well as the ability to provide statistical data on these cases to your government agencies. Now, during this demo, we're going to show various areas of the application, including the case management dashboard. On there, you'll see statistics, graphs, a list of cases, as well as the ability to do a data import and the capability for a staff member to manually key in a new case. The interview form is where a user can collect answers to a series of questions that are designed to help the system perform a risk assessment on the individual. We'll also show you a preview of the workflow and rules that drive the system and the risk assessment calculation. And lastly, the system has an inbox. We'll show you how it can provide reminders and triggers for your staff to follow up on existing cases. All right, let's get started. I'll share my screen.
So this is Bill Slovan. I'm also on the product team with Nick. One thing to keep in mind about the ClearVue platform is it's a completely hosted solution, so there's nothing to install or configure. It's hosted in an Azure data center in the cloud, and it's secure. It's using high-level encryption. So there's nothing in terms of getting you up and running. There's no installations needed. It's just a matter of configuring your particular site into the environment.
Right, thanks for that, Bill. So I'm logging in as a demo staff member, and the first screen we're going to look at is the case management dashboard. This is the primary view in the application for a frontline staff member. On the top left, you'll see a series of graphs that shows a breakdown of cases by zip code, with each tab up on the top representing the risk level of the case. And ClearVue is very flexible. These graphs can be configured so they're tailored for situations where your organization might want to see the data from a different perspective. The tiles off to the right show the breakdown of cases or the aggregation of cases, demonstrating things like total case count and number of urgent cases. And we also see a list of cases in the bottom portion of the screen. This acts as one of the staff members' main work lists. It shows all the cases currently in the system. Just keep in mind that all the case data you see here is fabricated. These aren't real people. Another point to mention is that the dashboard allows for sorting and filtering on any of the fields in the report. That way your organization can drive your staff to work items in priority order as needed. Currently, this report is grouped and sorted by priority. So we can see here that the urgent items appear at the top. Cases can be imported easily using the import cases feature via a spreadsheet format that's very simple and straightforward. And I will show you an example of that. So here's an example. You can see minimal amount of data, very few columns, and easy to export your data into this format if you've got it in your existing system. The system also provides a user case creation screen. And on this screen, a user can key in the values for a new case.
So one of the things you'll notice, that first field that Nick just filled out, case number, that can be used for your own internal case number. So in addition to ClearVue storing or creating a unique number for every case, you can also enter in any case number you might have from any existing systems you have or any other documentation you've received.
Just finish filling this form out. We can also specify a priority on the case. All right, so the next step would be to conduct an interview on a case. You might have the need to conduct multiple interviews or subsequent interviews on a case for follow-up, and the data from each interview is captured and stored in its own symptom data record in the system. The top portion of this screen shows the demographics for the individual. Next, we show a section where we collect information about contacts and current conditions and symptoms. And further down the screen, we ask a series of questions about history of various pre-existing health conditions, as well as the screen evaluates where and how the individual might have been exposed to the virus. So I'll go ahead and conduct the interview. You can see that we've got several components in the screen that include drop downs and slider controls. The drop downs are populated with values that can be customized for your need as well.
And so while Nick is filling this out, we base this initial form on some requirements that we got from a local partner of ours. We're also in the process of building another form that's based on the CDC PUI form around COVID-19. So that's scheduled to be finished up probably in the next few days. And we also have, as we'll talk about in a minute, after Nick finishes submitting this, we also have some self-assessment capabilities where an individual can be given an email or a text message, and from that they could then fill out their own assessment, answering the questions about their current symptoms, which would then feed it back into the ClearVue system and get associated to their case within the system.
Right, so the next screen we see here is the risk assessment and follow-up screen. So at this point, the ClearVue workflow engine has run through a series of rules to calculate the individual's risk score, and that's highlighted at the top of this next screen. We can see, based on the interview that was conducted, the application tells the staff member that this person is at a high risk, and they should inform them that they should seek medical attention and keep themselves isolated from other people. A few other great resources this screen provides: the preventative measures and the clinics near me. The preventative measures link takes you to right to the CDC website. So you can either provide that link to the individual, or you can pull out some key pieces of information from here and provide it to them, potentially in an email. And if the individual is looking for clinics near me, we've got a link here that links out to Google, so that we can search for clinics that you can provide to the individual. There's also a checklist of items that the staff member can decide whether or not to educate the person about. And as they go through this list, they can indicate which ones they might have completed so that this can be tracked and potentially reported to the government agency or to the CDC. Further down to the bottom of the form, there are follow-up tasks, and your staff member can act on any one or more of these list of follow-up items. For instance, we likely want to set a follow-up time to call to reassess the individual, so we can schedule that. We might want to schedule that for 3 days in the future. And the follow-up type is where we can ask the individual how they would prefer to be contacted for follow-up. So this can come as a phone call, follow-up interview, or a self-service message hyperlink that gets maybe sent to their smartphone or email so that they can perform the follow-up interview on their own. Or maybe you could request a packet of information or protective equipment and supplies.
And the idea here is all of these things can generate workflows within the system. So in other words, if you check that option to send supplies out to the individual, that could then create a task, and that task would go to whomever on your staff is responsible for that, and then they would be able to then provide those materials and then complete that task.
Right. So let's take this opportunity to take a glance at the workflow, and that way we can give you a little view into how ClearVue's workflow rules engine assesses the risk of the individual. So here we've got a workflow that gets run when the interview is submitted. And we can see that part of the condition that evaluates the risk is the person's age and pre-existing conditions. We can jump into one of the rules here.
Right, and this is an example of what a rule looks like, and you can see it reads in plain English. It's a series of conditions, and these can be customized and modified for your needs. They're very flexible in how these rules work, and this is basically the core of the workflow engine, is that it has these rules to be able to ultimately make decisions.
Okay, and so now that we've submitted the interview and scheduled a follow-up, your staff can leverage the inbox here, where this kind of shows all of the cases that the logged in frontline staff member is following at any given time. So this is where you would be able to provide your follow-up. And you can see that if we've got a case in our inbox for follow-up, we can conduct a follow-up interview, and it'll bring us back to the interview process.
And each of these interviews is stored historically, so you can report on that. You can take that data and export it out if you need to send it to another agency. We've got a couple things in the pipeline in terms of being able to look at a patient's case in its entirety, looking at all the history and trending. So that there's quite a bit you can do with that data as you start to collect it, and it's all stored in the back end for your use.
Okay, so just to do a little recap, we spoke about how this application can help to manage the workload of cases, as well as to provide a mechanism for delivering necessary statistical data to your government agencies. We also reviewed the various components and screens of the application, and as we pointed out, some of these features can be customized for your individual need. We covered the case management dashboard, the data import capability, and the individual case creation screen, the interview form, and as well as the fact that the system provides you with a risk assessment and the ability to perform follow-up interviews on your cases. So that completes the live demo portion of the webinar.
Hey, Nick, this is Bob. Just had
Sure,
a
Bob.
question came in about the self-assessment. Someone asked just if that could be clarified. They're not quite sure what the self-assessment meant when you were saying SMS and email. Could you just, you or Bill, just clarify that?
Sure. So what you can do is instead of having the individual, instead of having to call the individual when you do a follow-up, you have the option of sending them an email or a text message. And what that'll do is if you send them an email, for example, they'll get an email with a link on that particular day and time when you set the follow-up. And when they click on that link, it'll take them right into the interview form where they can then fill out a self questionnaire. They can answer the questions, what their temperature is, what their symptoms are, and that'll store it right into the system. So your staff wouldn't have to make the phone call. And alternatively, if they choose text message, they would get a text message to their phone, and that text message would then prompt them with a series of questions, the same kind of questions that you see in the interview form, go right to the phone, and they can just answer them yes, no, as they run through.
Sorry, and there was another question about the reporting. So when you need to report this out, let's say to someone else, either another agency or internally, how does the reporting work?
So the reporting is simply an export. So the data that you see right here in the dashboard can just be exported out to an Excel spreadsheet. We're also working now that the CDC has published some HL7 interfaces that they're supporting for COVID-19. We're working on an interface for that, which would then allow us to automatically deliver the data to the CDC. That's coming probably in the next days or weeks. So that would be more of an automated interface. But if you need to get the data out to local or state governments, you can simply export it to Excel and then manipulate it into whatever format you need to.
Okay. If we have any more questions, please go ahead and feel free to ask them. We have just a final share with you. So as we talked about along the way, there are still some features that we're working on fine-tuning and enhancing. The initial data entry form. So what you saw today was the capability to do an interview, and that was an interview based off of a case of information you already had because of imported information. So we are actually working on a data entry form that you will have to initiate and create the case. We're also working on what you guys see on the right-hand side. Many of you are very familiar with this person under investigation form. We are creating a form that is curtailed to this CDC form and specifications. You heard about the individual self-assessment form. This is the form that you can send the URL or have an individual fill out for themselves. We're going to make that a little bit different than the interview form and curtail that more towards that self-assessment versus the frontline interview. Contact tracing. In the interview form, there was that question as if they'd come into contact with anyone with COVID. We are working on the feature to actually drill down and save that data so you can do contact tracing and not only follow up on the person who is exhibiting symptoms, but then follow up and see if there's been follow up with the person that they have been in contact with that has COVID. Additional alert flags and task creations and much what Bill just spoke to, the reporting format capabilities. And so as we go through this, we are going to be evaluating the need by each organization that contacts us. And we're going to try and help prioritize those needs so we can help those that need the most help first. We know that resources are down and we want to do anything and everything we can do to assist with that. So again, as noted, we'll be offering the license free for 90 days, and we'll be discounting any configuration or support needs for that pricing. So I'm going to close this here. Bob, did we have any last questions that came in?
No, that was it, Janet. We're good.
All right. On behalf of Brandon Systems, I want to thank you all personally, especially those of you on the front line, going out and following up with individuals, taking this information and having to deal with this crisis. We personally want to thank you so very much. And that's why we still feel so strongly that we are offering this free to the health government agencies to start utilizing this. So we will be sending out the link to this particular demo for you to use. Please share it with others. We'll be having subsequent demos. So if there are other individuals you speak with who might be interested in reviewing, feel free to reach out and contact us. If you have any other questions, your registration information had my personal email address, jblag@brandonassociates.com. If you have any other questions after you digest the material you've seen today, please feel free to contact me at any time. Thank you and have a great rest of your day.
All right, so if you've stayed on this far, what we've done is we invited you back into each of our little environments. We're all kind of living the COVID dream right now, and as you can see, everyone at Brandon Systems is also being very safe and being very virtual. Shout out to Bill in the back screen there, the pigs do win. So as I said, Janet Blag, I am the director of the solution delivery here, and I'll have each of the guys on introduce themselves very briefly, and then we're going to actually dive into just a few more features we wanted to share with you, but we had promised to keep the webinar brief. So with that, Bob.
Yeah, hi, I'm Bob Rice. I'm VP of Client Services here at Brandon, and happy to have met you guys virtually, and looking forward to seeing if we can work and help you with your workload for COVID.
Bill.
Hey, Bill Sloven, VP of Software Development here at Brandon. We really thank you for the opportunity to present to you and take some time out of your busy day, and we hope we can help you guys.
Dennis.
Hello, Dennis Rosen, Chief Technology Officer. We are here in it with you guys and hoping to help out.
Warren.
Hi, I'm Warren Banghart. I'm one of the developers here, and I hope this product is of good help to you.
And Nick.
Hi, everybody. I'm Nick Migliaccio. I'm one of the product specialists, and I'm the one that gave the demo. We're appreciative of your time, and we hope something that we're doing here can help your organization out.
Absolutely. So with that, we're going to get back onto Nick sharing his desktop, and he's going to take us through where we've gotten so far with the CDC PUI form.
All right, here we go. Okay, so this is the CDC PUI version of the interview form. As you can see, we've made quite a bit more of a sophisticated form that parallels the form that you might be more familiar with. Quite a bit more information. And this is still under development, but it should be coming down the pipeline in the next couple of days.
Yeah, and Nick, let me just add that one of the reasons why we're using this form is, from what we understand, a lot of the reporting requirements, both locally and state and federal, are guided by this form. So it may be that currently you're not collecting all this information. I think one thing we could say is, if you look at it, chances are everything you are collecting is on this form. There just may be more. The way this form will be designed is that you can put in as much or as little information as you care to collect. But if you are reporting up to state and federal, filling out this form, I think, is the most complete. We also talked about the fact that we're working on an HL7, an automatic interface for doing those reporting. We expect this type of reporting to have to continue for quite some time. We don't think it's going to end in the next month, 2 months. I'm sure you guys are more aware of that than we are. So what we're trying to do is build a system that allows you to continue. The other point about a lot of what we've done is the technology we use, the ClearVue technology, as the requirements change over the next several months, we'll be able to, along with you, change how we're reporting, what the rules are that are used, so that without you guys having to do a lot of individual changes in work, we're hopeful that we can do the work behind the scenes and allow you to stay focused on doing the reporting that you need.
Absolutely. So again, much to the dynamic features of the workflow capability powered by ClearVue. So Nick, we also wanted to show them the close case feature functionality.
Yes, thanks, Janet. We wanted to kind of keep the demo within the window that we slated because we know you guys are very busy. So we ran out of time. We didn't have an opportunity to show one other feature that's in the ClearVue COVID-19 case management system, which is the ability to close out a case. So if you're looking at your list of cases, in addition to the conduct an interview, as you need, you can click on this close case action, which will bring up another dialogue where you can choose a disposition and you can close out the case.
And we do recognize that your dispositions might be different. They might be referred to differently. You might need to use code numbers, and that is certainly something that we can support doing. All right, and lastly, one of the things that we talked about, I'm going to go ahead and share my screen now, Nick, if you don't mind.
Sure.
One of the things that we had talked about was the whole idea of being able to, in your interview, ask the interviewee how they would like for you to follow up. And so we said the SMS, we said texting. And so what we wanted to share with you is this is real. Yes, this is a screen capture, but this is working. And this is what we meant by SMS. So simply they can trigger it by calling in, or you can trigger it by sending to them, and it goes through the same questions, but it does log the information. So if they don't have access to a computer or browser, and they do want the conveniency of doing it on their own, you can offer this to them.
And that information gets associated to the case. So it would look within the case management system just like any other follow-up interview. So it's attached directly to their case within the system.
Absolutely. So in the case where you would give them a browser, they can access this by their computer, mobile, any devices that they would like to use, and it's the same form that they would be going through with you, or in this case of the self-assessment form, they'll have access to it on any device that they choose to use to access the browser.
Yeah, and again, just to clarify that you have a case, you need to follow up on that case. You can give them the option of following up by self-evaluating. In other words, they're going to fill out the form, or you can call them. But if they say they're going to self-evaluate, it still is in your system and in your work list that if they don't, you would get a trigger to call them again. You don't lose the case. It's not manually being tracked. The system itself is keeping track of every case that you have and making sure that you can, through the dashboard, see how many cases need to be followed up on, whether or not they're late, what the current disposition is, what the priority is, and all of that is provided for you. We suspect that over the next several months, the number of cases are going to increase, and that your ability to be able to do this in an efficient way with the limited staff that you have, that's really what our challenge was to see if we can build something that can help you do that. And we think we were successful. We hope that you'll take a look at it. If you have interest, you can reach out to Janet, and we'll talk one-on-one with whoever is interested, and we'll work with you to see if we can get this to help you.
Absolutely. So thank you for staying on for the last little bit to watch this segment. And as always, like we said in the webinar, if there are other features and functionalities that you need, we will be speaking with the first few clients, and we are more than happy to see what we can do to build those into this application.
Okay, thanks.